Say that with love.
Every 10 seconds, a new Black mind is birthed, eyes wide and brimming with Black abundance. Swaddled in mama's arms, all neck and arm rolls, 10 fingers, 10 toes, full term and whole. Here, Black mamas receive premium prenatal care, mentally, physically, emotionally prepared, heard through pregnancy and birth as mothers, nation nurturers, but nourished first, feeding Black babies abundantly.
Welcome to Say That With Love, a podcast where we reimagine Black childhood with legacy, liberation, and love. I'm your host, Dr. Leah Austin, the president and CEO of the National Black Child Development Institute, and I'm also known as the president of the Black Children. So let it be known that in this space, we love Black children unapologetically and out loud. Today, we're centering what feels like it should be a simple dream, building a world where every Black child is born at a healthy weight. However, we know it's not that simple because a healthy start in life is not a right that is guaranteed to all Black babies. For that reason, birth justice demands that we honor the human rights of Black children. To nurture Black children, we must honor the health and the dignity of Black mothers and birthing people. Today, I am joined by Leah Hairston, a doula, educator, and mentor who leads Sweet Bee Services, which has the mission to end maternal mortality. Leah has supported more than 130 families with trauma-informed and justice-focused care, and she finds the time to mentor doulas through the National Black Doula Association. Leah was also a contributing author on our paper, Afrofuturism and Systems Change. Together, we will explore what it takes for every Black baby to be born into care, dignity, and love. Welcome to Say That With Love, Leah.
Thank you so much, Dr. Austin. It's a pleasure to be here.
It is indeed wonderful to have you. And I do have to just pause to say that this is special in many ways, but there are two in particular. We have the same name.
Yes.
Spelled the correct way. No shade to any other spelling, but this is the correct way. And of course, we both went to Howard University.
That's right.
So it is indeed
exactly
special and a pleasure to have you and to be able to learn from you and just really share with our audience your expertise and really to help the audience to understand more about what it means for a child to be born at a healthy weight. And so I actually want to start there. So we often think about being born at a healthy weight, being about a range of numbers or pounds in this case. And so I'm curious about giving some framing for our audience. When we say a child is born at a healthy weight, what does that mean beyond the number on a scale? What does it actually mean for a healthy, thriving, joyful childhood?
Absolutely. So from a number standpoint, being born at a healthy weight means that a baby is born above 5.5 pounds. And typically that means between 5.5 and 7.5 pounds. What we found is that on average, Black babies are born disparately below 5.5 pounds, which leads to a number of concerns, not only in their immediate growth and development in that framework from 0 to 3, but also for their lifelong trajectory and their ability to do well in school and their ability to maintain healthy relationships and their ability to achieve financial stability. And so what we're looking at when we're saying that Black babies deserve to be born at a healthy weight is that we're saying Black babies deserve to thrive for their entire lifetime. And we can do what was within our control to make sure that happens from birth by supporting not only the baby, but the person that is pregnant with that baby to make sure that they have the resources that are necessary for them both to thrive.
So maybe give us a little bit of a baseline understanding, right? So folks who may understand, okay, so a baby should be born between this pound range, right?
Mhm.
Do we know why Black babies are not born at the healthy birth weight that we believe they should be born at? Or what are the reasons why?
Well, the research has shown that we are still trying to figure out how to pinpoint what is the
Mm,
exact reasoning. From my research and perspective, especially as a trauma informed practitioner and as a social worker who focuses on macro or systems work, there is a system at play, and each of us is within that system having to navigate personal battles within meso or middle level battles, meaning that if I am pregnant, the things that are impacting me are not only what's going on biologically in my body, but also any work stress, any relationship stress. How's my ability to navigate transportation to get to work? How's my ability to navigate taxes and finances so that I can care for myself?
mm.
How am I interacting with my healthcare practitioners? And so all of these pieces, depending on if they are in a positive light and supporting my health and well-being, or in a negative light causing trauma and or stress, then that also impacts my baby and my baby's health. And so the research that I'm so honored to help lead at NBCDI is really to help us focus in on how can we improve these outcomes by making sure that babies thrive, by helping their birthing parents to thrive, and making sure that we are clarifying as much as possible what are the contributing factors. And when we understand those contributing factors, then we can create sustainable changes that mitigate those risks.
Thank you. I want to follow up and ask you this because I feel like, and correct me if I'm wrong on this, but
Sure.
I feel like we often, when we think about healthy birth weight, and in particular the disparities that we see with Black babies and Black families, there's an idea that it's personal responsibility,
Hmm.
that individual pregnant person's responsibility. So there can sometimes be this mental model or a mindset from the general public, perhaps, that, well, if that mom ate better food and went to prenatal care and took better care of herself, then more Black babies would be born at a healthy weight. Is that accurate, what I'm saying, in terms of, is that a challenge that people believe and then also keeps us from being able to really pinpoint the solutions that would really support Black mothers?
You are absolutely correct in that it is a common misrepresentation of especially Black mothers, particularly because the research that has been done has not been done by us and for us to be able to explain what's going on within our communities and to explain our needs. There has been, especially in the last 10 to 15 years, a more public outcry around what we need and what is happening in birthing experiences and the resources that are not being readily given, especially to Black women. But when you talk about and think about mental models, there are several unhealthy and erroneous mental models that are held in the public about Black moms in particular. One is that we don't experience pain in the same way. One is that we are smoking and drinking and causing harm to our babies and willingly doing so. And another is that the Black fathers are not present and not a part of the parenting experience. But I have been a doula and been in the birth world for 10 years. I've also been a researcher for 15 years. And so, in my experiences, not only from a research perspective, but hands on the ground with families, that's just not true. And so, how do we make sure then that the stories that are being told reflect what actually is happening in real life? We have to do the research. We have to be able to communicate it in ways that other communities and other systems understand so that we can help build a bridge to say, what you believe is not true, but here's what actually is happening. And here's how we can together work towards a solution.
Absolutely. And I want to come back to the research. So I love that you
Hmm.
brought both your research experience and your practitioner
Hmm.
experience into the conversation. And want to just ask you a little bit more about your practitioner experience. So, what first drew you into
Hmm.
this work of caring for mothers and birthing people? What brought you here?
Well, I am honored to be the daughter of a Black mama who had Black mamas before
Absolutely.
her. And
Absolutely.
I'm also honored to be the oldest of four siblings. And my siblings and I were all born within a very short period of time, like about 5 years. So I remember distinctly my parents getting pregnant, going to the hospital, coming back with a baby. And I'm like, y'all keep doing this. What is going on? What's happening? And in my mind, things started to shift very quickly. I was
Mhm,
like, okay, you go in and have a baby. My life is being interrupted, I should say, or reconfigured. But
mhm.
I also am curious, like, what does that mean for my mom? And watching my parents, they had just moved across country shortly after I was born, so they were away from community, and they were navigating raising four little children by themselves, and it was really stressful. And they've done a beautiful job. We're all successful now, but I can only imagine, and in my conversations with my parents have asked, what would it have looked like if you'd had immediate community, what were
Mm.
some of the health struggles that you navigated? How did you know how to ask questions? And a lot of it was that they didn't know what questions to ask. They had to fumble through and figure it out. And they had communities that they had to actively build in order to get that support. And they were always looking for the answers. To me, I'm really grateful that they did that, but I also feel like it should be their inherent right and that they should have access to inherently supportive community, people who have the right answers, people who they don't have to necessarily like fight to find doctors, but that they have a
Mhm.
plethora of healthcare practitioners available and not in ways that are going to pull from their resources, but really enhance their ability to parent. That was the first sort of spark for me. And then as I grew older, I learned about doulas, but I only saw doulas, white doulas, to be very honest, and I only saw white doulas with white clients. And
Mhm.
so I never thought that Black people could have that type of support in our birthing experience, especially within a hospital setting. And so I just saw Black people having health complications, like in the news, and white people having access to very supportive, nurturing birth experiences. And I've always had a heart for justice. And so I was like, well, you know what? I'm going to find a way to fix this. And so I thought I was going to go to medical school. And in my pursuit for medical school, I found that what I love more than anything, like I am definitely a science nerd. I will read the medical journals till, cows come to town. But I really love being able to translate information for people. And so being
Mhm.
able to be a student of the medical field or anything that I'm doing, and then going back to my clients and helping them understand so that they have access to information and can make an informed decision. And I love seeing people step into that persona of feeling empowered and being able to walk with that and knowing that they were able to take control of their birth experience or their healthcare experience at a time when somebody said that they never would be able to.
I'm also one of four. I'm not the
Mm.
eldest. I'm number three.
Okay.
When there's so many, you have
I
to sort
love
of
it.
say
Yeah,
the
you just
numbers
figure
in
out
a
which one.
different way. I'm number three. So I totally understand
Yes.
how that has shaped your
Mhm.
perspective and has shaped your coming into this work. I want to ask you about research and
Mhm.
how that has shaped your not only your perspective, but how it's shaped the experiences of mothers and birthing people. So I've heard you
Mhm.
specifically about the origins of American gynecology.
Yes.
And so I wonder if you might just share a little bit about that history, but really, how does that history still shape the
Mhm.
experiences of mothers and birthing people today?
The study of gynecology as we know it today actually started in many ways in the US and was formalized and medicalized in the US during the time of enslavement of African Americans and Black folks. And so during that time frame, because doctors formerly had not been fully respected as medical experts, there was a movement to have doctors become the well respected experts and have midwives or those who had practiced colloquially to become the lesser experts or dismissed within the field. And in that movement, there is a physician by the name of Marion J. Sims, who is credited in the study of gynecology with perfecting techniques to fix fistulas and other concerns post birth and having to do with women's reproductive systems. But he also conducted barbaric experiments on enslaved Black women in that process. And what he did within those experiments, and I think it's because those women were trying to reserve some form of dignity, he did
Mhm.
not credit them with experiencing pain in the same ways that his white patients did. And so he would often say, and in his textbooks, it's seen that Black women were labeled as female and closer to animals and did not experience pain, which is why they were closer to animals
Oh my
than white
God.
women.
Wow.
And so his work and research and barbaric
Mhm.
experiments laid the foundation for the field of gynecology, and all the medical textbooks that have to do with gynecological processes and care are based off of that. So even in
Mhm.
2019, 2021, there were textbooks coming out for nursing school students and medical students that said that Black and Brown people did not experience pain to the same degree. We didn't need the same levels of medication. And these are false. These are outright false
Right.
because we're human beings. We all
Of
have the
course.
same systems.
Of
But so
course.
when I think about, the research, I had to go figure out, well, okay, I heard in the early, 2000s, Black women are dying at disproportionate rates when they have babies. And I'm like, well, why? It's not
Mhm.
like our bodies are any different. It's not
Mhm.
what is contributing to this. If we've been having babies since the beginning of time, what's all of a sudden so dangerous now?
Right.
And as I did my research and dug deeper, seeing that rates for Black women with a college degree were higher, were at greater risk of dying than those who do not have a college degree. Whereas across the world, your access to education always decreases your level of risk. I'm like, well, why not for Black women? If we're highly educated, what is going on? And so it wasn't about access to money. It wasn't about access to education. It's about the system and the ways that systemically people's thinking has been influenced to be biased and prejudiced. And if that matches with somebody who already doesn't have the same sort of respect for a human being, it leads to lack of access to medication when needed, not believing people when they say that, hey, my baby's coming right now, you need to come deliver, or I need this medication because I have this health concern, or not reading someone's medical chart and then mixing up medications across, not taking the time to personalize our healthcare the way that we deserve. And I want to be clear, there are phenomenal physicians, there are phenomenal midwives. So it's
Absolutely.
really a systemic issue. It's not always just one person. But when we don't take the time to understand the foundation of something and the beginning of something, then there's a quote I love that says, the misuse of anything is abuse. And so if you don't know the purpose for it, you don't know how things started, you can't also fix it and create a solution that's most meaningful for people.
And just thinking about the relationship between history, right? And in this
Hmm.
case, the origins of American gynecology and the disparities and the inequities that we see today, in
Yeah.
particular for Black mothers and Black families.
Hmm.
You've named some, but are there other examples of how these disparities show up in how maternal health affects Black families and what Black families might be quite literally experiencing when they're in their prenatal care or they're in a birthing room?
I mentioned earlier how fathers are often ignored in the experience. And I think that has been one of the biggest lessons with my own clients. And something that I often teach my doula students and mentees is that partners need to be included from the very beginning. And
Mm,
partnership often doesn't always look any one way. And so being clear that the ways that people have different family dynamics should be
mhm,
honored and inclusive. If it's grandparents involved, if it's the
mhm,
best friend next door, if it's, your cousin up the street or a couple states away, having everybody have your husband or partner, whomever it is, the father of that child, having them also involved in the experience from the beginning and not just like sit in a corner in the hospital bed, but coming coming to all the appointments, making sure that they're informed because they also have a lot of emotions tied to this experience, but they've been excluded from the conversation. And I've seen that when fathers and partners are excluded from the conversation, they have no outlet for their emotions. And it leads to additional relationship stress for families. Whereas
mm,
that partner is needed in the entire process so that they're informed, they know how to process their own emotions, they know how to show up for the birthing person, they know how to speak up in the hospital room and say, but that's not on our birth plan. And hi, my name is so and so, and put me on the
right.
board too. Like you're not going to just
Absolutely.
ignore me. I'm not a
Mhm,
passive person here. I am an active participant. So I
mhm,
think that in many ways, because most of my clients are partnered with Black men, I think has to do with a fear of Black men and an inability to engage with them as human beings as well. So I want to name that. I think another piece is that there is an assumption that we don't understand our medical records and how to navigate our own
mm,
healthcare, which might be true. If you're using all this medical terminology, I have no idea what that means. I never took a
right.
Latin class. Like, what is that supposed to mean? Um, Having the capacity and the intentionality to slow down and say, hey, do you understand all
Mm,
of what I just said? Within a system where you only have 15 minutes for an appointment, that's really difficult. I
right.
recognize that. That's why I always tell people get a doula because they can sit with you and walk through it. They can help you format what questions to ask. But a lot of times there are assumptions that hold people back on either end, either from the patient client perspective, or like they don't have time for this, they don't really care, it's not that important.
Mm,
And from the physician perspective, I'm exhausted, I'm tired, I need to eat something. They seem like they don't have any questions, so they should be fine. But that's not the case. It's that our silence actually is hesitation as opposed to contentment. And so being able to ask the other person, one, if you're the practitioner, do you understand what I'm saying? And
mhm,
having the capacity or someone else available to help translate. And then if you are the client and patient, knowing that you have the most power in this space. You are not powerless just because they have a white coat. And I often explain to people that the most beautiful birth experiences happen when the expertise of the physicians and the expertise of that person come together so that you are the expert in your body and what's going on with your baby from an internal standpoint. They're the expert in their field of study. And so when you bring those two together, that's how we have healthy outcomes. But it requires intentionality on all sides and a dismantling of perceived power dynamics to be able to have that happen.
absolutely. And are there other systemic inequities that show up in prenatal care? Or and so I know that sometimes we talk about prenatal care, we talk about the birthing room as separate things, where often it's happening kind of together in the same place, if you will, sort of place and space. And so just wondered, are there other systemic inequities that you're seeing that are showing up in the prenatal care space, or specifically in like the birthing room space?
Absolutely. I think back to even like the research we're currently doing. We had a conversation with a mom who shared that she found difficulty getting prenatal care before she hit 16 weeks because there was a lack of resources. So, not necessarily from her personal resources, but there were very few obstetricians around in her area. And that goes back to there are fewer obstetricians being trained because medical school is very expensive and time consuming. And so the number of people coming into the medical field is way lower than it should be to meet the demands of our country.
Wow.
It also tied to the fact that the places that she wanted to receive care, she was not able to book an appointment because they didn't believe her when she said, "Hey, I'm 12 weeks." And they're like, "Well, how do you know you're 12 weeks? You haven't had a pregnancy test." She
Oh,
said, "But
wow.
I'm coming to you to get a pregnancy test so I can figure this out."
That's why I'm calling you.
Exactly. So I'm trying to do what I'm
Wow.
supposed to do. But the way that she was received on numerous phone calls with different clinics, the ways that she was even trying to navigate like the obstetrician's offices and the front desk, she was like, it pushed me to the point of even like, do I need to bring this baby into the world? Am I going to be able to get access for my family's health needs? And so that is also a systemic issue. It's like she was one of the mental models is that Black women are not trying to get prenatal care, not caring for their bodies,
Right.
during pregnancy. But if I'm trying my very best on top of morning sickness, on top of still needing to go to work, on top of other family and friend responsibilities, on top of trying to feed myself, you're making it impossible. And you, meaning like the system, feels impossible to navigate as she's trying to care for herself.
And with some of these mental models, I mean, you kind of feel like, why would a person choose not to access prenatal care? Like, it baffles me that would be a
Yes.
serious thought in someone's mind, that, oh, Black women just, for some reason, don't want prenatal care. Or no, that's not it at all. It just doesn't feel like it makes a lot of sense that an
Absolutely.
individual would make that kind of choice without challenges and obstacles that almost make that choice.
Precisely.
That's not a choice, really. It becomes kind of a
Yeah.
mandatory circumstance.
Absolutely. Because people who are healthy want to stay healthy. People who are pregnant care about they're like, okay, what do I need to do? Everyone's researching. Everyone's in these like deep dives on the internet of what's happening at
Oh
this
my
day and
gosh.
how big is my
Yes.
baby right now. So everyone who's becoming pregnant, that's typically what's happening is trying to figure out how to take care of myself, how to take care of my baby, and what do I need to do? People just want to be prepared. And so when we come in it from that perspective, then we can see where there are outliers and maybe we can support those outliers. But if our assumption is that the majority of people want to care for themselves, let's make it easier for them to do that.
As I listen to Leah, I'm reminded that birth is both deeply personal and profoundly systemic. From the excitement of a pregnancy test or a gender reveal to the quiet moments of worry and fear, every family deserves care that honors both their joys and their fears. At the same time, we must ask, how are our systems working together to truly support Black mothers and birthing people? When Black mothers are not heard, believed, or given proper care, those are not isolated misses. They are patterns rooted in systems that have been built without our thriving in mind. And yet, communities are creating new patterns. Doulas, midwives, birth workers, and OBGYNs are working together as care teams to provide care that is empowering, humane, and effective. These Black practitioners are not only resisting broken models, they are world building. They are practicing collective imagination, designing systems of care that are rooted in dignity, joy, and love. This is not only about surviving childbirth. It is about welcoming every Black child into the world with dignity and love, and ensuring that parents can fully experience the miracle of birth. Leah, what gives you hope when you look at the movement for reproductive justice?
I think the thing that gives me the most hope is our stories of victory. It's
Mm,
the stories and touched lives and experiences where families are thriving and they are succeeding, even with having to navigate the various hurdles that our systems throw at them. I think back to my most recent client who gave birth this month, and despite a number of pregnancy losses, rounds of IVF, being told that she was too old, that her husband had issues, having a stillbirth experience, they had their rainbow baby recently. And that baby was born without any form of medical induction that she was told she'd have to have because she was over 35. She was able to have her baby at 40 weeks, despite being told that she wouldn't be able to carry to that long of a pregnancy. And he was born at 7.5 pounds. And that little chunker is thriving and breastfeeding well and
oh,
the sweetest little baby smells. And so these are the stories that keep me going, even when I'm at, 25-hour labors or
mm,
when we have to intervene and tell a physician they can't touch somebody in that way, or when someone says that, they couldn't get prenatal care for the first trimester of their pregnancy. I know that it's possible because I've seen it done and I've helped it be done for over 140 families. It's just a matter of making sure that we are just as intentional in redesigning the systems so that every person gets the opportunity to have that access. And that it's not just something you have to pay for or a one off
mm.
experience, but that is the true standard of care that everybody can experience.
I love baby feet. That's my
Yes.
when you said chunker, I'm like, oh, the baby feet. I
Oh,
love
he's just
baby
so
feet.
adorable.
Oh my goodness. So let's end with this. So I want to ask you, you just named redesigning the
Hmm.
systems or reimagining the systems that are at
Hmm.
play. And so I want to kind of think about the future with you for a second. So
Yeah.
if you could design the future of maternal health care for Black families, what would it
Mhm.
look like?
Mm. Every Black family would have access to a Black obstetrician gynecologist that also meshes with them personality wise, if that's the choice that they have. If they would like to go with a midwife, they have a Black midwife that they trust and have a great relationship with. Every Black family would have the right resources to navigate concerns around preeclampsia or any sort of blood pressure concerns. But they would also be with practitioners who don't just assume that they will have those diagnoses because they're Black and pregnant. Every Black family's baby will be born at 7 pounds and higher, with no need for medical intervention because everything runs smoothly. They have access to education that they need to understand the birthing experience and how to make decisions that match their desires and needs. And every Black family would be supported in each choice that they make, whether it's to have a C section or a vaginal birth, whether they'd like to breastfeed exclusively or include formula. They have access to pediatricians that respect them and their decisions. And they have access to early childhood care, whether it's in home or daycare, and schools that they know that they can trust their children to be in, not only for their physical, but also their emotional safety.
How do you balance support for individual families with advocacy for wider systemic change?
I see them as integrated. So every time I'm working with a family individually, I'm also thinking about the systems and how to advocate on their behalf, but I say more so advocate with them so that they are speaking the loudest and I am like the boombox for them. I see it also in terms of when I'm afforded platforms and opportunities to speak. I'm always thinking about my clients and I'm informed by each of their experiences, the dynamics within their family, the needs that they have, but also the desires that they have and the relationships that we've built. And so I believe that true advocacy is sharing the lessons from relationships to help improve the outcomes for more people and folks who may not have had that same experience. And I think that by becoming a more well-informed advocate and a more not even always outward facing, but a more vocal advocate, I've also become a better practitioner when I work with families one on one. So I would encourage people who are trying to figure out the balance of it. I always explain that it's more rhythm than balance. And so you figure out what times you have the emotional and physical capacity to be by someone's bedside. And when you don't have that capacity, use that as an opportunity to write, to read, to lobby, to, join other people who are already within the movement and making sure that for those who are active doulas or healthcare practitioners or community health workers, that you never lose the skill set and the timing of being by someone's bedside because that is what informs our advocacy. And for those who advocate without being by the bedside, maybe it's your own experience or your family and friends' experience that fuels you. Never forget the stories and the experiences of people, because that's really what we're advocating for.
Absolutely. Thank you for being here with us today.
Thank you for having me, Dr. Austin. It's my pleasure.
Absolutely. Birth justice is all of our work. It is quite literally the beginning of any effort to create a more just and joyful world. Ensuring every Black baby is born at a healthy weight means centering care, compassion, and dignity for their families. So here's the invitation. Explore NBCDI's Black infant and maternal health publications at nbcdi.org and use them as a resource to guide your work. If you're a practitioner, look up doulas and community birth workers where you live and add them to your referral list. If you are a doctor or other medical provider, please listen to Black mothers and believe what they share about their care. If you are in philanthropy, support, invest local birth justice groups with your resources. Every action matters. Together, we can world build a future where every child is welcomed into the world with love, dignity, and possibility. Thank you to our guest, Leah Hairston, for her wisdom and insight. Say That with Love is a podcast from the National Black Child Development Institute. This episode was created with our ABF creative production team and our partners, and with love for the communities that inspire this work. And to Black children everywhere, we love you unapologetically and out loud. I'm Dr. Leah Austin. Thank you for listening.